I
का.
feel like it's precision that they're looking
Absolutely.
for. Part 2 may take your time. Practice every day. It's a big financial setback as well.
After ORE, you are on your own, right? Like you are responsible to find your own job, to find your own attachment. It's not GRE की responsibility.
There is an अब थोड़ी सी इस चीज को highlight किया जा रहा है because there was a deficit of dentists in the UK.
Yeah. Hello and assalamu alaikum everyone. Welcome to another episode of Dental News Podcast. Today we have a dentist whose journey reflects a lot of persistence and definitely a lot of adaptability. She has worked across multiple roles. She has been a dental nurse, a dental hygienist, and now is a professional licensed dentist in the UK. And I'm excited to know all about it. Let's welcome Dr. Shiza Anwar. Dr. Shiza, thank you so much for your time. Thank you for coming to the show. How are you today?
Thank you, Mariam. Thank you so much for having me. I actually feel like, it feels like a privilege to be on this platform when, there's been such big...
It's an honor having professionals like you who have not only made it in their lives, but are ready to talk all about their careers, even the lows and the ups. And trust me, I'm going to ask a lot of the questions about the lows.
Amazing. I feel like every journey has its highs and lows.
Absolutely.
And most people talk about the highs without actually touching on the struggles because, again, it's the brave front that we put on the brave face that we put on for the world. But we need to talk about, every aspect of a journey together with its highs that, come after a low.
Absolutely. And this is what, like we were just talking before this as well, this is what makes it relatable to other people as well.
Definitely.
Because the reason why most people, for example, they dream of or they plan on taking a licensing exam abroad, but अगर आप 10 लोगों से ये सवाल करें ना जिनका मूड तो है अब्रॉड जाने का लेकिन उन्होंने कुछ भी किया नहीं है प्रैक्टिकली इसके बारे में तो वो 10 के 10 आपको ही जवाब देंगे कि we're not sure where to start from A and B we're not sure if we will really make it at the position that we're hoping to go for कि अच्छा अगर मैं डेंटिस्ट हूँ और मैं एज अ डेंटिस्ट ही जाना चाहता हूँ तो मुझे ये तो बिल्कुल नहीं पता कि मैं एज अ डेंटिस्ट कितने अरसे में लैंड कर जाऊँगा. एक ये भी मेरे ख्याल से रीज़न होता है वाई पीपल वांट टू मूव अब्रॉड इसके पाकिस्तान में तो पैसे कमाने के प्रॉस्पेक्ट्स नहीं हैं तो इस वजह से हम बाहर जा रहे हैं तो आई बिलीव दिस मेंटालिटी इज़ ऑल्सो व्हाट काइंड ऑफ सेट्स पीपल बैक क्योंकि वो बाहर जाते हैं और फिर उनको रियलाइज होता है कि पैसे कमाने के प्रॉस्पेक्ट अभी यहाँ पे भी इतने ज़्यादा नहीं है.
Yes, I feel again we're focused more on the end result than the actual journey.
Absolutely.
And we're not prepared for the journey. So I think expectations are what actually bring you more down because you feel like, it's going to be a very smooth sailing A to B kind of journey.
Absolutely.
But then there is different dips and lows that you actually overcome, not just as a dentist, but as a person abroad as well.
I think everybody has an idea that there's going to be ups and downs, but because they don't know how down the down would be. They don't know what the...
will end.
Exactly. So like a lot of people who are going through the journey at the moment, whenever there is a low, अभी हम बात करेंगे exactly कि वो lows क्या थे, लेकिन whenever there is a low, तो फिर आपकी वाली बात वहाँ पे valid हो जाती है. They don't know if this will ever end. If this is the continuous situation we're going to live in, क्या हम हमेशा McDonald's पे job करते रहेंगे? Yes. So like that's when a depressive phase hits and a lot of people quit at that time. But for example, it's people like you who, alhamdulillah, not only like stayed persistent, but then got out of it and then have made something better for themselves. Today is why conversation with you is needed so that you can tell कि नहीं, you're going to move on from McDonald's. There's going to be better things.
I feel making mistakes actually makes a person more stronger in a way कि you've seen the worst of something and then you've still managed to come out of it with a lesson. Again, it's not going to be a linear journey, whatever you do in life, not just in dentistry, like, marriage, for instance, or any other relationship in life will not always, be smooth sailing. You will have certain points in your life where you will be tested. And again, I feel like as a Muslim and as a human, you have to first have that faith that you will be tested in everything in life. And I feel like I've had my fair share of tests in every aspect. And not just in dentistry, but actually every aspect of my life, I've been tested. And at that point, it feels like it's never ending.
Acha, I know this is a bit of a general question, but what do you think helps a person most while going through the uncertainty of how low a low is going to be and for how long this is
It's
going
your
to last?
faith. I feel this was the biggest strength I had when I had nothing. And again, my faith wasn't as strong when I was here, because again, you have a support system, you're cushioned from the blows of life because you have family, you have friends, you have people to turn to. But being in an environment where you don't know many people, although I went into a whole new family, but I feel like during your lows,
Bilkul.
you are still alone, right? You still have to manage those things by yourself. And that's when my faith and Allah being present in my life, and then me turning to that aspect for strength is what helped me.
Absolutely, क्योंकि वैसे भी जब आप graduate हो जाते हैं and all your friends are doing different things with their lives now, तो फिर it's like कि even if we do have a conversation, I'm not sure if they will be able to understand my exact problem.
Yes.
and have a solution for my exact problem. क्योंकि जब like FJDC में सब साथ पढ़ रहे थे तब तो सबके एक ही मसले थे, सबका prof थे, पास नहीं हो रहा, whatever.
We were all in it together, basically.
Exactly.
But when you move away from a country where you're in your comfort zone, you're actually alone in every single thing you do, like down to the fact that the being far away from family, nobody else understands or relates to, because you're the one that is experienced.
Absolutely. अच्छा, तो take me to the very beginning. आप मुझे बताएं कि what motivated you towards dentistry, even though you're the daughter of a very infamous dentist, but still, like, what motivated you to join dentistry yourself?
I feel, being the eldest daughter, I had a very strong role model as a father who I looked up to. I was with him constantly in my younger years, and I could see the respect and standing he had made for himself as a professional.
Did he decide this profession for you? कि मैं dentist हूँ, आप भी dentist बनो?
In very subliminal ways, like he would get me a T-shirt that say I'm going to be the next dentist or something.
Best dentist in the world.
Yes, it was maybe like in a very subtle way coerced, but then there was this expectation.
सही.
But again, it was me choosing it for myself. I used to say from a young age that I wanted to be a dentist.
ठीक है.
I think as a person as well, you feel like the difference you make in somebody's life when you take them out of pain. As I grew older, I felt like people would hold his hand and thank him to say you've been the best dentist, or like you solved this problem that I've been having for years. That itself was rewarding, whether you get paid for it or not. So again, it's a very
also satisfies the elder daughter itch.
Yes.
I need to fix this.
Yes, exactly.
Right.
I need to fix things without wanting to fix it. You just want things.
Right, absolutely. Well, it's a very running joke, honestly, and every time I see a reel or meme about it, I'm like, relatable.
Yeah.
Iske, elder daughter in healthcare, obviously.
That's it. You're going to make it.
Right. अच्छा, तो फिर by the time you graduated from FJDC, वैसे आपका house job वगैरह का experience कैसा था?
Again, I need to touch on this because Fatma Jinnah itself, like, every institute has its pros and cons, but I feel like focusing on Fatma Jinnah, the concepts that they gave me, the base and foundation that they gave me, I am truly indebted to my teachers who taught me at a very high standard. They were there for us. They were coaching and helping us through this early part of our journey.
Right.
And I feel like they were on par with the education and the systems that I saw abroad. So
that's
felt
incredible.
Like I didn't have a complete shock, because we had already seen and heard those things constantly being taught to us.
Achha, how long did it take after graduation from like to the point where you appeared in your ORE versus when you graduated?
Again, I think my journey was not full throttle, I'm going to go make it as a dentist in the UK. I had a few, I let circumstances also dictate, my journey as a dentist. Again, we earlier we were off record talking about, women and, how motivated they need to be as a dentist or a career woman. We let society dictate, what a woman should be doing and what her priority.
A lot of the times, yes.
So I think I've just lost my train of thought.
No,
now.
so like I was asking कि मेरा वैसे पूछने का मकसद ये था कि usually जब बच्चे graduate करते हैं private college या या government college जिससे भी, तो feel very under confident as a fresh graduate कि हम कहाँ कोई licensing exam clear कर सकते हैं. तो where did that confidence
so again,
come
like
from?
as being coming from a dental family, I knew I wanted to be a successful dentist. But going to the UK was actually my circumstances, because I ended up being married or engaged to a person who was from the UK. So and I kind of
सही, तो आपकी link direction set हो गई थी कि भाई यही करना है.
Exactly. Again, if it was up to me, I would be a little bit more confused about where to land and where to go.
Absolutely.
So now that I had a bit of direction, I knew that again, practicing dentistry in the UK needed this from me.
अच्छा, Dr. Shiza, sorry, before we move forward, I have a question, because आपने एक बहुत अच्छी important बात point out करी है, and it is like that for most of the women who have to move, who are professionals, especially healthcare में, क्योंकि मुझे तो ज़्यादातर healthcare का ही पता है, जिनमें आपको ख्वारी होती है licensing exam clear करने की. बाकी तो I think it's not that I mean, I'm sure it must be hard for other people as well, but sticking to healthcare, a lot of women tend to not decide a direction for themselves in terms of which country do they want to move to, because they're kind of thinking, चले मैं अपनी भी बात कर लूँ अगर, तो I'm always thinking कि अगर मैं ऑस्ट्रेलिया के लिए अप्लाई करके चली जाऊँ और फिर let's say मेरा हस्बैंड टिम्बकटू में रहता हो, तो फिर क्या, तो फिर मेरे तो सारे पैसे ज़ाया हो जाएंगे ऑस्ट्रेलियन एग्जाम के. तो like what advice would you give to those who are afraid of setting their own direction for themselves?
I feel we are evolving as a nation, but we also still hang on to these, expectations that women need to be led by men or approved by men. That there is an external source of validation that you need to gain from the society and the people around you, which obviously makes it harder for us to set our own paths. But then again, in dentistry, I feel like we are evolving to the point where you feel like, apna path banao and things will fall into place. So I feel we need to break out of this ki mera husband yahan hoga to main apni dreams chhod dungi. Maybe you will meet that right person on that new path that you've taken. So sometimes we maybe cause delays in our life waiting for that validation कि ये वो husband आएंगे तो the path will
तो वो बताएंगे कि अच्छा हम तो यहाँ रहेंगे.
Sometimes you take a step and the path just comes
right,
in front
absolutely.
of you. So maybe you will meet that right person.
I'm very glad you said this, because एक तो आपके लिए this particular circumstance in terms of who are you going to marry decided कि आप UK जा रही हैं, but still coming from you कि नहीं, don't wait for your circumstance to decide that for yourself is pretty important.
Yes, and I feel it comes from also my upbringing, because my dad, who's been such a massive, role model in my life, I've learned literally like, personality related things from him, and then dental things from him as well. My communication, my dealing with people, it comes from him. He raised us because I'm the eldest daughter of a family that has 4 daughters and then a son.
Oh.
So he raised us like sons.
Right.
And that's why I feel, although my circumstances were such that I got to decide about UK because I was engaged to someone, but I actually, in a way, I did decide to marry him as well.
Exactly, and also to pursue your profession.
He gave us the strength and confidence to also make our own decisions, and he backed us in things that we chose. Like, marrying my husband was my choice. And my dad actually did think, I have a whole setup here. Why are you going to a country where you have to start over?
Okay.
I feel that was my choice.
Right.
I chose him because I liked him as a person. I met him quite early on in my life. He was family. But I feel like my dad still supported that decision. Although he would have, wanted me to have an easy way into dentistry in Pakistan.
Exactly.
So I made things harder for myself, but I stand by my decision. And again, that's the strength and confidence that my dad has given me to choose what I wanted in life. And I
Absolutely.
feel like, although I did say that, circumstances landed me, I feel like I had a part in those
Absolutely, you
circumstances.
did, and like
Yeah.
you even had the chance to not go do the hard work that it required to become a licensed professional in the UK, right? Or like
Yeah.
considering अभी हम आपकी journey के बारे में भी बात
Yes.
करेंगे कि you did not become a licensed professional directly, so उससे पहले भी जो आपके stages थे, you could have gotten comfortable in any of those stages and
Yeah.
think, okay, यार, I'm doing fine,
Yeah.
but you did not, and you wanted to
Yeah.
like get to the point where people start
I
calling
didn't
you.
want to settle for being just another person in another country.
Right.
I knew dentistry was a big part of who I was. And again, that comes from a father figure who's also, shown us how wonderful it is to be that. And the biggest reason for him pushing the rest of my siblings and us women into dentistry, it's because he said, you can work as a medical professional in a 9-to-5 job, gain the respect of a normal doctor without the, the hours that are not favorable for women. I know, again, that's a stereotype that we have as a nation and as a Desi Muslim, women, that we have to work reasonable hours and not be outside of the house. He used to think that it's a very good, comfortable position, profession for women while still making it big.
Right.
So it was, it's just like a no-brainer, I feel.
Right. Okay, so let's talk about your early journey towards when you were transitioning into UK.
Yeah.
तो आपने अपना ORE part 1 UK में ही दिया था?
Yes, I did.
Right.
Again, it didn't happen straight away. I did lend circumstances because I was a wife. I was trying to get used to the life in the UK.
सही है.
I went in knowing I wanted to do dentistry, but I didn't just, जैसे सर पे सवार कर लेते हैं, that's the only thing I want to do. I enjoyed life a little bit.
सही.
I had, personal setbacks in terms of, I had a few miscarriages before I even thought about dentistry, which completely shifted me down to being a mom first. And again, I want to talk about the lows because I did battle those things behind closed doors. My friends.
So like a lot was going on in the personal aspect as well.
And my friends used to be progressing, in Pakistan. Even my own sister, mashallah, she has been probably gaining experience and practicing for longer than I did because I went in as, a newbie in a different country. Then I had personal struggles that, friends used to be like, kya chal raha hai? You started preparing. But I was silently facing struggles that probably I didn't speak about much at that time.
Right.
Now I do because alhamdulillah, like I told you earlier, it's my faith. I hit lows in every aspect of my life to be able to bounce back.
Absolutely.
As a stronger person. And alhamdulillah, I feel like it's my faith in Allah. During every low, I knew He would give me something after testing me. So again, it's that blind faith.
It's definitely important to have that faith. It keeps you going. Otherwise, there's a lot of reasons to be upset and depressed.
So once I had my daughter, I felt like, alhamdulillah, I felt accomplished as a woman. I don't know why, but there is this.
Pretty sure you're otherwise very accomplished as well. But congratulations on your daughter.
But after losing, having babies that I lost, it made me want it even more. And again, it completely shifted my focus away from dentistry. I wanted a healthy child. And alhamdulillah, once I had that, it made me want to then touch on
then think about other important. Absolutely, everybody has their priorities and you had yours. And again, I'm very happy that it worked out for you, mashallah. So talking about your professional journey, then when you started thinking कि अच्छा ठीक है, now I want to like start thinking about setting my career in the UK because this is where I live now. तो आपको वैसे ORE, did you always only consider ORE बाकी pathways जैसे LDS वगैरह, were you aware of those at that time?
I did, but I feel like LDS was a bit of a slower route in terms of, the attempts weren't as much, the seats weren't as much. So I don't know why. I just picked ORE because everybody around me at that time, I had seniors who were going to the UK, and all I said, I had the privilege of knowing that I'm going to end up in the UK, so I could actually turn to
do your homework,
that had been to the UK. Like alhamdulillah, the person I did my my part one prep with was a senior from Fatma Jinnah. And we
Acha.
both knew we were going to end up in the UK. So we connected while we were there. We did the prep together.
Right.
And then I had other friends who had already passed before me.
Acha, this is the question that I was going to ask up. Ki, how did you prepare for part one exactly?
Part one was, again, you have to navigate, what they expect from you, what the criterias are, what the exam formats are. Once you understand that, again, that's the biggest thing that helps you prepare for an exam. You need to understand the ins and outs of कि क्या pattern होगा, क्या questions होंगे, क्या weightage होगी, clinical, non-clinical, and stuff. Once you understand everything, and that comes from, speaking to people that have done it, reading forums. There's so much out there. There's academies, there's, professional.
So like how did you plan your preparation strategy?
At that time, I think it was more of, people who'd passed would actually guide you and coach you better, because I did this back in 2015, which was almost 10 years ago now. Now, since then, there's been academies that actually have their own notes. So again, I wasn't aware.
But you did it without academies.
I did part one on my own.
Right.
And it was just from feedback from people that had passed it. And I don't want to big myself up. I'll always thrive in chaos. That's my personality type.
Eldest daughter trait.
Exactly. Yahan pe bhi I would actually just study for my exam. So again, I had wasted a lot of time getting to know about the exam, but I sat down at least 3 to 4 months before the exam. Again, I don't want to set unrealistic expectations.
No, but we're
even
just
my
discussing.
friends used to be like, how do you do it? Even for my profs, pura saal chill karte hue, and then I would actually
No, but it actually proves that it's doable this way, even if it doesn't work out.
But I would say realistically, you need at least 3 to 6 months. I would say start filling the ORE ka form, because that itself
is like a 3-day job.
No, not even that, because the requirements, they send stuff back and forth. They're not happy with something. Then you have to keep connected
document
with your
verification
college and your professors to write your clinical.
अच्छा, I have a question. तो आप already ORE में थे जब आपने अपना part 1 दिया, तो वो जो अपने college से communicate करना होता है in terms of documents and everything, how did that process work out for you?
Again, it helps coming from a dental family, because I had people that could actually go and do that the job for me, while I could just pick up my phone and tell them. But
were your siblings also in FJDC?
Yes, one of my sister was from Fatma Jinnah, and 2 other siblings from Altamash. So we've got a good balance of the best institutes of Karachi.
Absolutely.
But so it was hard. Like, I felt like it was a bit frustrating, because when you go to the UK, things are predictable, processes are predictable, whereas in Pakistan you'll be like, अच्छा उनको phone किया है, अब वो phone नहीं उठा रहे, अब ये नहीं हो रहा. So I think things are a lot long-winded in Pakistan than they are abroad. Getting this document is not as easy.
Also, responsibilities are not very well divided among the administration. मुझे तो सबसे ज़्यादा गुस्सा इस बात पे आता है.
They were just shoving onto each other.
Exactly.
And then
मतलब आप माशाल्लाह से इस XYZ कॉलेज की एडमिन की रिसेप्शन की डेस्क पे 16 साल से तो बैठे हुए हैं, और आपको ये नहीं पता कि मेरा कैरेक्टर सर्टिफिकेट इसने प्रिंट करवा के देना है. Makes no sense.
नहीं, I feel like university itself was quite, we had, I think Rahman साहब थे जो काफी अच्छे थे. He was quite reliable. I feel like we had
God bless Rahman साहब.
But it's more about, the time frame. You can't predict how long something's going to take, because they'll be like, आप कल आ जाएगा या आप 2 दिन बाद आ जाएगा. अच्छा, वो ये हो गया.
तो फिर आप क्या?
But this is generally not about just institution. This is generally Pakistan for you. I feel like now coming back to Pakistan, I feel a bit disoriented, because I'm used to things actually flowing
in a systematic way.
Yes. So this is probably a very stark difference between the two.
So like, would this be your suggestion that during house job we should utilize the time to get our documentation
100%.
done?
I feel like again, this is the advice that I would give you. Part 1 is something you can give as a fresh graduate straight away. You should rush into it, because you're connected to your college. Again, that gap between you and them is shorter. So, you can get things processed quite easily, whereas
Sahi.
once you're a bit disconnected, then you have to make your way,
Like,
and then
who
it
you?
kind of and then
आप
that's
कौन है?
what it is, वो amnesia, selective amnesia हो जाता है, कौन सा
Like,
batch
हाँ, यहीं से graduate किया आपने? जी सर, 6 महीने पहले graduate किया।
yes, exactly. So
Right.
utilize that time to actually do, and a lot of kids do that. Do that hard bit, documentation.
लेकिन हाउस जॉब में माइंड मेकअप करना भी तो बड़ा मुश्किल होता है ना. लाइक विल गेट बैक टू योर जर्नी ऑफ पार्ट 1, लेकिन सिंस वी आर ऑन द टॉपिक, अब व्हेन आई वाज डूइंग माय हाउस जॉब, आई न्यू कि मैं अभी अपनी एडमिनिस्ट्रेशन के पास जाके बोलूँगी कि मुझे ये डॉक्यूमेंट चाहिए, तो बोलेंगे जी डॉक्टर मरियम अभी निकाल के दे देते हैं, दैट्स ग्रेट. बट देन मुझे नहीं पता कि मुझे अभी पार्ट 1 यूके का करना है या मैं एडीसी का करना चाहती हूँ, या मैं थोड़ा सा अगर आईएनबीडी देख लूँ वो कैसा चल रहा है. सो दैट्स अ प्रॉब्लम.
I think too many options is also a problem, right? You have to narrow yourself down. And again, through my faith, this is also something that I've been a person who wasn't sure of a lot of things. But through building my connection with Allah and, my religion, I now blindly just do istikhara. I mean, we are so
why
lucky,
not,
right? We don't apply things so easily that we already know. So again, through the delays and the losses and the uncertainty in life, I learned istikhara is the biggest ease that we have as humans, and then there's no room for error when you do it, because the actual meaning of an istikhara is guide me towards something that's best for me financially,
in my religious aspect as well,
in my personal aspect, and move me away from things that are not suitable for me financially, mentally, personally. So if you actually read it, you're letting Allah guide you to what's best. So I can't stress it enough. Again, I feel like this is not a religious sort of thing, but it's my journey. I feel like now I blindly, when I'm unsure, like even if it's like, okay, we're relocating to this place, or we're going for a job, that between two, the actual current job that I'm in right now, I actually, they offered me the job there and there. They said, when do you want to start? I said, I want to go home and do istikhara. And my boss actually comes up to me and he's like, that istikhara really worked for you. Because
was that a Muslim boss?
Yes, he was. He was from the UK, but he was Muslim.
Okay.
So again, I feel like I've been led to think that we can make our own decisions, but when you rest that expectation from the person, or not the person, but the entity that knows the best for you in he can see in the future and we can't.
And then you also kind of become comfortable with whatever the decision is going to happen now, right?
Exactly.
Because you're like, okay, now I don't have to be too anxious about
it's not just that your heart actually becomes
settles down a bit
with what is chosen, the path that comes. Like I've actually had things that I was really inclined towards, that I was actually really indifferent about at the end. I was like, chalo nahi hua, because my heart became so set on things that were meant to be.
And that's the important part, right? The nervousness and the anxiety to go away. So I'm very glad you touched that topic. Thank you for sharing that. So now, you decided कि अच्छा ठीक है मैंने part 1 करना है, और ये बिल्कुल बगैर academies के और सिर्फ अपनी पढ़ाई से था, right? तो please tell me कि how does group study work, and how did you make it work in your favor when you were preparing for part 1?
I feel that's the only way to prepare for ORE, because you cannot do that in a solitary position. Again, even in dentistry, during profs we used to do group studies for literally everything. It's not just because you have the moral support, but also sometimes just discussing things with somebody mentally kind of reinforces the concept in your mind than just you sitting there with a book. So
absolutely,
ORE, you need solid study partners. That is the biggest game changer, and I've also had a journey with my study partners. In part 1, alhamdulillah, like I said, I already had somebody who was my senior at Fatma Jinnah, and we both knew we were going, and somehow after years we were lost in motherhood, and she was married to somebody from the UK and I was, and then we just reconnected. We're like, let's just do it. Again, it was like, I think we're ready. And then it took us 3-4 months of like daily studying together, and we both alhamdulillah did it together. So this is a very big part of passing this exam. You need
अच्छा, तो आपने एक पॉइंट मेंशन किया कि यूज्ड टू स्टडी एवरी डे, तो डू यू हैव टू बी कंसिस्टेंट व्हेन यू आर प्रिपेयरिंग फॉर पार्ट 1 लाइक दैट, या फिर
again, I feel like if you leave it like me to the last minute, where you just have less time, like 3-4 months, it has to be on and I feel like one of my really good friends, Fatima, who had done it before me, she was also one of the biggest guide for me in ORE. She actually said 3-4 महीने तो तुम्हें रोज और 8 घंटे पढ़ना पड़ेगा. Like she'd done it, so she actually laid it down. So that's why I feel like talk to people who've done it, so you know both ways. But I feel like if somebody who's not a procrastinator like me and leaves things last minute, if you're studying for 6 months, maybe 4 or 5 hours a day and consistently, you can do it. Whether or you
ये तो बहुत realistic study schedule है.
It is, but again, it just depends on your concepts as well. Like, but then at this, in this day and age, we have AI, right? You can actually take a picture and summarize things. हमारे ज़माने में तो ये नहीं था ना. Like, give me the gist of this topic in dentistry. You have AI videos.
Well, it has made us smarter and dumber both, but depends on how you use it.
In a way,
depends on how you
I
use it.
feel like, you know, there's concepts in now animated videos of physiology that we had to imagine.
Definitely.
We had to imagine कि भाई ये क्या process हो रहा है in our heads, because that was just a text.
Right.
So I feel it's a lot more easier. You can study smarter in a shorter period of time. You just have to build your concepts and revisit things that you already know from
Absolutely. अच्छा, तो let's talk about part 2 a little, क्योंकि part 1 तो आप सही कह रही हैं कि you just need to have the right motivation and consistency and also the right attitude and surroundings.
Yes.
बाकी study material तो कोई इतना बड़ा मसला नहीं है, वो तो वही है जो आपने अपने undergrad में भी पढ़ा था, and then there's like other books वगैरह as well.
And there are certain topics that they fixate on quite a bit, like, you know, वो feedback से पता चलता है कि, you know, people that have done it over the years, they'll be like, ये topic बहुत आता है, ये topic बहुत आता है.
अच्छा.
So talk to people who've done it. Go on forums. There's so much on there that you learn so much from, rather than just sitting there with books on your own.
आपके हिसाब से सबसे ज़्यादा topic क्या आता है?
अब तो मुझे बिल्कुल भी
आपके टाइम पे क्या आया था?
I think this the part 1 is 2 papers basically. So paper A is non-clinical anatomy, physiology, biochemistry,
basic sciences,
and part B was the very next day all your clinical subjects. So you need to be taking them together and
exactly.
not thinking कि मेरे पास time होगा next day करने का. And then you're also sometimes just shattered from day 1, that you feel like you can't even concentrate on. But again you have to detach yourself from the experience of the exam on the day and focus on, again, we're in Pakistan, we're used to that, right? Because हमारे back to back vivas होते थे and stuff.
Right.
So again, there's I think things have changed. Back when I did it 10 years ago, there must be different topics that are now
right
relevant.
Absolutely.
But the dental legal things, their statistics. Statistics पे वो बहुत focus करते हैं, the percentages, the statistics and stuff. Yeah,
अच्छा,
at that time they used to.
We'll talk about that too. अच्छा, मुझे ये बताइए, you talked about having the right attitude when you walk out of the examination room as well, because अगले दिन भी आपने part B अब दोबारा देना, या फिर अगले दिन या कुछ घंटे बाद, whatever. So you tell me, how was your experience when you saw the question paper for the first time? Considering ये तो UK का पहला exam है जो आप दे रही हैं.
Again, it's down to the institute that I was from. We were actually, you know, the best choice questions. It was literally this in a similar pattern that we had already done. So it's not anything.
Nothing out of the box.
No,
right?
Because I feel like education in Pakistan is good theoretically
up to par.
and practically. It's just sort of the systems, the protocol, जहाँ पे पाकिस्तानी ज़्यादा मार खाते हैं, you know. Clinical stuff, the guidelines, they're very strong about following set protocols and guidelines, and as Pakistanis find cut corners, find ways to do things that we want to do without any checks and balances. So I think that
अच्छा, this was my next question for you as well, कि जब आप part 2 के लिए prepare कर रही थी, तो do you think कि आपकी जो already clinical knowledge थी जो आप पाकिस्तान से लेके गई थी, was that good enough, या फिर did you have to learn dentistry from scratch for part 2?
I think clinical knowledge is something that stays with you for life. You don't have to unlearn and relearn clinical knowledge, like procedures that we actually do, anesthesia, restorative procedures, oral surgery. They're very good procedures, and I feel we have an edge when it comes to clinical experience in Pakistan, because हमारी OPDs में the patient flow is
अच्छा, ठीक है.
massively different to what they're exposed to in their.
But the way we're practicing is not
That's
what they
again-
expect.
Again, it's the protocols and the processes. The actual clinical skills are actually higher in Pakistan. So I would give this advice to people that are pursuing ORE, that part 1 तो आप दे दें फौरन
सही.
अगर आप दे सकते हैं, but I did it after 5 years and I still did it. So it's not like there's a hard and fast
You did it
rule
after
कि
5 years,
I did
okay.
it after 5 years. And again, it's revisiting things you already know. But part 2 ka I would emphasize, I feel like this was the thing I struggled with, is the clinical experience, because I got married and I moved
Okay.
6 months into my house job.
ठीक है, तो फिर
So
how
then
did you?
I was, if you look at my CV, I was coming back and forth and I was trying to get my hands dirty when I came to Pakistan, just so I wouldn't kind of drift
That was
off.
smart, but was that enough? Like how were you feeling?
It's not enough. It's not enough, because again the gap causes you to become more apprehensive. The career gap or the clinical gap. So initially
ठीक है.
those nerves become even more daunting.
तो फिर
Which is why my transition actually helped me. It absorbed the shock that you get from practicing dentistry, because I started working as a dental nurse. I was in a dental environment.
Okay. Was that after
During
part
my-
1?
That was after not passing part 2, actually.
Okay.
Yes. So I attempted. So my journey went from giving my ORE part 1.
ठीक है.
And then I kind of just slowed down a bit, because again, clinical experience matters a lot
Sahi.
in part 2. And I didn't have that. So
Sahi.
I did make sure that over the next few years with a child, I was coming back and forth. I was touching up on skills.
Oh, you
I
had a
was-
child by the time you were
Yes,
preparing for part 2.
Part 1, I had a child.
Oh,
already.
okay.
Yes, I did. Like I told you, I had struggles with
Right, and that's
pregnancies.
when
And once I had my daughter, she was 1, and that's when I thought,
you were
I've
like,
given
now
her
your
time
mother
now.
is going to become a dentist.
I need another
Watch
feather
it.
in my cap,
Right.
which I probably felt like I was born to do. So I gave a part 2 time, and part 2 you shouldn't rush into. With
Achha.
part 2, make sure, my experience is that you should at least have 1 to 2 years of clinical practice. If it's more, then that's
After house
even
job, can I count house job as my clinical practice?
You can, but I feel you're still in your comfort zone. You're being cushioned. You're being guided. When you're
Acha.
in associate roles, even in Pakistan, you're left to your own accord, right? You need to make clinical judgment there and then. Nobody can come and save you. Whereas at university, you have house officers. and
अच्छा,
you
ये
have-
आप eligibility wise नहीं बोल रही ना, ये आप like as
नहीं,
a
eligibility wise
skill
नहीं
building
बोल रही।
wise बोल
वो
रही.
तो all that information
Yeah.
is available online. I'm just guiding that I had that setback because
Okay.
I got married and I moved and I didn't have clinical practice, for that long. So I did come back and forth to kind of gain that. मैंने जिना था JSMU में भी थोड़ी सी attachment की, and other things. I was coming back and forth. I was shadowing dentists, and that helped me. But I feel like get clinical experience and confident with the handpiece, because part 2 demands precision under pressure.
अच्छा, तो आपने part 2 से पहले this was the only like preparation you had कि मैंने जो पाकिस्तान में जो आपने आके practice की हुई थी, that's it.
And then part 2 you need to join academies.
Sahi.
So part 2 is a completely different forte. You have to maybe that was the expectation. There are academies that actually coach you to the standards that they want. They have exercises that you need to practice. तो वो आपको guide करते हैं कि आपको कैसे prepare करना है, कितने घंटे करना है. I had a mannequin and a compressor in my house. And every dentist, ORE dentist, this is a common thing. You have to practice with a handpiece on a daily basis to get that level of precision, because you can't expect कि आप वहाँ से आए और आपकी वही precise cutting हो. Their criterias in the practical is
down to
very,
the last
very
millimeter
harsh.
they will check.
It is precise to that point. And I feel like the part 2 that I couldn't get through was because my amalgam class 2 was 0.1 or 2 millimeters too wide, and that's the reason that they gave me.
Oh God.
Yeah,
that must have been annoying. But
and that's like, if you part every component and your precision isn't right on that day on your mannequin, you have to retake the whole exam. I mean, I felt like that was really unfair because you've done all components flawlessly.
And
But
then
it's
that
just the
one
precision.
stupid
Yes,
component
even if you flick the tooth or something during preparation,
while you're working, yeah.
They will.
Are they observing that keenly?
They come to you, they let you perform, and then they go to each station to look at your prep.
ठीक है.
And there's not just one person, there'll be 2-3 examiners that are walking to every person, and they will look at everything.
फिर तो मुझे कोई reason समझ नहीं आता why there would be any sort of biasness towards like dentist जिसने और ही clear कर लिया भले वो पाकिस्तान से आया बांग्लादेश श्रीलंका.
I feel like it's precision that they're looking
Absolutely.
for. So again, part 2 may take your time. Practice every day. It's a big financial setback as well, but it's you take your courses that are recommended, wahan ke jo hain, do mock exams. I booked all of that because I feel like it takes the edge of being in examining conditions in a different country as well. Financially, don't think about, each tooth costs about 2-3 pounds. And we had to cut thousands to get that precision. So again, if you've got that experience, again, the handpiece control from years of practicing in Pakistan, that will help you. And I feel like,
but you still need more.
You need to just confine and refine yourself.
Achha, theek hai.
Whereas with me, I had forgotten how to do dentistry in indirect vision. You can't even look in direct vision. If they see you bending, that's another point that they will hold you against, because you're not supposed to bend. You're supposed to have proper chair positions.
Exactly.
And you have to do upper indirect vision.
हम तो यहाँ पे scaling भी कर रहे थे तो palatal vision यूं करके अंदर छाके थे.
So again, it's just refining things that you already know, but you still need a lot of practice.
Right, that makes sense. अच्छा तो Dr. Shiza, आप क्या बोलेंगी कि what is a realistic timeline for ORE? House job के बाद for part 1, फिर कितने देर से बाद part 2?
Again, like I said, do it as part 1 as close to graduating as possible. But again, I did it after 5 years. Give yourself 3 to 6 months. 3 months is a bit unrealistic, I feel, because then you're just anxious and working under pressure. Give yourself 6 to 8 months to comfortably familiarize yourself with the topics, revise, be consistent. And then for part 2, if you already have a good 1 to 2 years of clinical control practice in direct vision, then give yourself at least I would say 8 to 12 months to actually do mock exams, do practice to the levels. Because the thing is, when you're practicing on your own, nobody can point your mistakes because it's only what your eye is seeing.
That makes a lot of sense.
But when you go to regular mocks and tests, there's somebody that's criticizing.
They're going to tell you what you're doing wrong.
They're going to refine
and how to fix it.
You won't know your mistakes until somebody points them out. I mean,
absolutely.
I would send it to my friend, but again, it's that same level.
Exactly.
She was good. She passed her exams.
But still.
But again,
not
a
as
teacher
experienced.
who's had like 10 to 12 to 15 years of experience would actually know ke, aapko kya cheez refine karni hai. And again, I did sort of part 2 mein, there was 2 kind of academies. One was home-based and very lenient. And one was very critical.
Professional.
I would say learn from them both, because when you have low confidence, you need somebody to be a little bit lenient until you become a little bit confident. But closer to the exam, you need somebody to tell you how it is.
Okay.
So I did the opposite actually. I went to
the tough one first.
The tough one because they were more professional.
Sahi.
So they would actually like list down all your faults there and then, and I was like, I can't do this.
Imagine only having flaws and then
and that's how they are.
Right.
So, and again, I didn't pass in the first attempt because I had that big gap. I didn't have much handpiece control. So that precision, then managing the stress on the day, trying to prepare with a family, with a child. There was a lot of things that came into play. But when, again, you make mistakes and then you rise up, learning from those mistakes.
Absolutely.
And not letting those mistakes define you.
अच्छा तो we'll talk about your second attempt of part 2, but I want to understand, आपने बीच में एक बात mention करी थी कि you became a dental nurse after your part 2 when you didn't clear it for the first time.
So again, I was in that journey doing part 1, and then once I did part 1 in my first attempt, I was like, flying high. I was like,
मुझे
"बस ये
आता
तो हो
है
जाएगा."
मुझसे पूछे कैसे
Again,
पास
that's
करते
reality check. Again, not really like that, but actually thinking it's
but you start feeling
Yes,
confident about yourself.
You do. And again, with a child, I was trying to get to know about part 2 and managing time. When I didn't pass, it was a shock.
Right, especially for someone who's not ever failed.
Not used to ever. Not passing at a professional exam.
Absolutely.
Mocks वगैरह तो हम हंसी मजाक में चलो कर देते थे.
Right.
But that's in your mother institute. But that shock, I feel like Alhamdulillah is also Allah's way of how your journey is planned for you, because just a few days after not passing, I had a friend who just messaged me out of the blue. Again, it was a friend I had made through those academies. So again, you need that going into academies, because you need that support. You meet study partners there. You meet people on your own wavelength, people from your country. So it's actually quite helpful. So she messaged me saying, I'm leaving my job that was working as a dental nurse, and because I passed my exam, and would you like to join? Because वो एक job role बना हुआ है वहाँ पे.
ठीक है.
Overseas dentist working as a dental nurse.
अच्छा.
So that role that she took on was.
So you don't need to do a separate licensing to become a dental nurse.
No.
सही.
You just need to register yourself. I think pay something to register yourself as a trainee dental nurse. I didn't actually do the exam, but just to be able to work in the practice
and get paid. That's incredible.
You just sign yourself up and then do
right.
that. And plus, I think they prefer somebody, a trainee dental nurse who's a dentist, because they don't have to teach them.
Exactly.
So that role is a permanent role in the UK, where again, at that time, it wasn't. It was brought to my attention by a friend, and she passed in her first attempt. And when I spoke to her, she was like, I knew everything because I've seen it.
You're overqualified for it, no?
No,
right.
but also it's you're shadowing dentists, you're shadowing professionals that are working in the UK.
Right.
You're looking at the protocols that the exam asks you, एक OSCE station होता है.
अच्छा, सही. Okay.
To actually dispose things in the right box, right?
Right.
Or there's a sharps bin, there's a clinical bin, there's a domestic bin. तो वो आपको कुछ seconds में करना होता है. But as a nurse, you already know this. So, and X-ray positions, things like that.
So you became aware of the dental setup system in UK.
In that job role. Then I did doing my ORE,
academy prep, right?
And, those.
That's really
that I
nice.
Used to take,
so like becoming
it's applied knowledge.
So like becoming a dental nurse was a very smart way to get familiar with the
I feel like
ins and
I was
out.
so much more confident because I could see those things on a daily basis that they ask of you.
That's incredible.
And again, there's also like, when you're sitting in an exam, there's this memories that come to you, just like a light bulb moment that you saw. Maybe I saw my father doing, or I saw another dentist doing. And
right.
Like, oh yes, I know
it's
how
the same
they managed
thing.
it. So I feel shadowing and looking at dentist work as well, together with practicing yourself, is a massive
absolutely क्योंकि the alternate you have is कि आप किसी के पास जाएं और उनसे request करें can I please stand behind your back while you do a very complicated procedure,
and they're like an extra accessory that they don't want in their small space. So even sometimes abroad patients are not comfortable because it's a different kind of society where you need to get their consent to have a third person in the room, and most people would not want that. So this way you have the insider knowledge of a dental practice. You're holding the
you're an important person in the room as a nurse,
and you're actually supplementing that procedure yourself. So it helps you like no other course.
आपकी muscle memory बन जाएगी हर procedure as much as a dentist. That's great.
You're normally a very calm person in the exam because it's like it's your day in day out kind of job that you've been doing. So it's a very for me, like I say, it was a massive help because I was not in clinical dentistry for a long time when I graduated. But if you're in clinical dentistry, then again you already have quite a few skills that you develop. Right. But shadowing somebody in the UK is something that gives you... That
will definitely help you than not doing it. So, Dr. Shiza, you also worked as a dental hygienist, is that correct?
Yes.
So when did that happen?
I feel that itself is a massive journey.
Need
for
another
me as
podcast for
well.
that.
Because once you pass your ORE, nothing prepares you for the next step of ORE, right? You think you underestimate the journey that ORE is.
सही है.
You think that, that's the hardest thing that you will ever do. But actually navigating dentistry, getting a job in the UK, registering yourself, getting to know the legalities, कि आपको कहाँ टैक्स के लिए कहाँ रजिस्टर होना है in order to work,
सही.
आपको क्या requirements होती हैं, CPD requirements होती हैं, वहाँ पे we have to do 100 CPDs in a 5-year cycle, उसमें से कौन से हर year repeat करने हैं, medical. There's so many things that nobody tells you about. Again, that is a big thing, that you're trying to stand up on your feet in a new country, trying to navigate how to work as a professional.
सही बात है.
With a sword hanging above your head,
Oh,
that somebody
you have
could
to do
make a
this.
complaint and sue you at any point if you don't know what you're doing as well. So there's so many things that you feel like ORE is the hardest part in
but actually
your life.
practicing as a dentist, it's...
that is the easier part. Actually trying to find your way after ORE is a topic in itself. So that brings me to the question
hygienist,
that you asked me. When I passed my part 2, it was just before COVID. And I think it was 2019. And for me, I had seen friends who had struggled to find an NHS training in the UK. Friends who had relocated to a different city, 5 hours from where their husbands were, just to be able to get a job. I mean, at that time, the job market was completely saturated. There were European dentists that would come to the UK and take the jobs that, they would be given more of a priority after UK dentists for job applications. So we were like the end of the barrel. So people would settle for things that you wouldn't want to settle for. Like they would, on paper, want to pay you more than they would actually give you, just to be able to take advantage of people.
No, wait. Sorry. You're saying that a licensed professional, just because they're inexperienced or from a certain part of the world, are not being as...
There are clauses in contracts that would actually, be unreasonable.
Can you not file a complaint against those discriminatory clauses?
I mean, somebody who's relocated themselves doesn't have a backing in a new country. And again, this is why they get taken advantage of. Because if they don't have people who know that this isn't right.
Right. It's a take it or leave it for them.
It is. And I feel that's something that also caused a delay in me trying to find a job. Because once I made it, I felt like I didn't want to...
what were some... can you give some examples of like an unreasonable clause that you would see in an offer letter and think, oh, this is not for me?
I mean, it wasn't even an offer letter. They would actually pay you less than the unit dental value.
Is it something they do with everyone who's new?
Everyone who's an overseas dentist. And they would actually, I've been on interviews where they would say, what will you pay me to take you on as a trainee
Excuse me?
Yes.
Pakistani uncle, I left you in Pakistan.
Exactly.
That's very sad.
Exactly. I felt like it was also Desis that would actually take advantage.
No way. You would think that you would have a favor going into a practice where the owner is Pakistani.
Yes. So this is something I felt like I didn't want to settle for. I saw friends who, just because the training positions were so hard to come by, had to move away or commute 2 hours a day each side to go and do a training. And it used to be a year-long training, and sometimes they wouldn't sign you off because they'll be like,
Achha, so matlab after ORE, you were on your own, right? Like you were responsible to find your own job, to find your own attachment. It's not GRE ki responsibility.
There is an ab thodi si इस चीज को highlight किया जा रहा है because there was a deficit of dentists in the UK.
Yeah.
But during that time when I had passed and I was looking, people would settle for like a UDA value, which is like what you get paid for at activity that you do, unit dental activity in the UK. The going rate would be 10 or 12 and they would get paid 6 because they were overseas, and they would be like, the extra is my cut for taking you on as an overseas dentist because I have more to lose than you. They would actually say this on your face, and they would say, I get
More
funded.
to lose how? I cleared an exam.
And it's because it's a liability. They think that if you make a blunder when you're a trainee and you don't know what you're doing, if the patient would sue the practice, your mentor, or the practice has to pay for that. So again, they kind of took advantage of that and made you feel like you don't deserve any better.
Huh.
And like, locals that would graduate out of a UK university
यही मैं पूछने वाली थी, yeah.
would get a training position that was allocated by the regulatory bodies. So they go on interviews and they get a foundation training position based on, through the university.
Which college they graduate from, etc.
But we don't. We have to find stuff. So they actually said we're getting funded to take a UK graduate because the UK, the NHS pays the principal dentist to take on a UK graduate.
Of course, they take care of their graduats, but for the overseas,
there is proper funding allocated for new graduates that you're training in your practice. So like materials they would waste, or mistakes that they would make, they fund you in a very.
So what do you think could help an overseas dentist who has cleared their ORE in terms of getting a job?
So that's why I feel like being a hygienist actually helped me, because I passed my ORE and I had somebody who I knew out there who had a private dental practice. She called me.
So networking.
Again, networking helps. But it's also, the best thing at that time actually falls into place if you believe in that. At that time, I felt like, okay, I'm just a hygienist and all my friends are, are actually dentists. They're doing every procedure and all I'm doing is cleaning people's teeth. But that refined a completely different aspect of me in dentistry.
Which was what?
So UK dentistry was solely NHS dentists, where you had to follow quotas and targets annually, not keeping in mind
the quality. Acha.
The NHS allocates certain units to each practice, and then the principal allocates those units per clinician.
Okay,
you just have to meet those criteria.
So for example, अगर मेरी practice में 6 units हैं, तो उनमें से 2 probably NHS के.
No. They give you units of treatment.
Oh, okay.
You have to do 20,000 units of treatment.
ठीक है, makes sense.
And you then allocate 1,000 units per day to per year to a clinician.
Units mean number of patients or number of hours? Or number of procedures?
It's actually really confusing. Units is actually a unit of dental activity, which means a checkup and an x-ray has 1 unit. So you do that under one
so procedures, but not in...
Anything restorative can be 3 units to 5 units to 7 units, depending on what procedure you're doing. So it's a completely distorted way of practicing dentistry, and it's different to what we do in Pakistan. But since Brexit and since COVID, there has been a shift where private dentistry is kind of pioneering in the UK now. And a dental hygienist was a private sector job, which meant that you either get paid for the hours that you put in, or you get paid a percentage of whatever you've done. Whereas the units was like, if you're doing a root canal on a molar, even back in the day, used to get 3 or 5 units, which means अगर आपकी unit की value allocate की है 5 pounds or 6 pounds, you would times that by 3 and that's what you get paid.
Bro.
Yes.
For a very massive calcified molar root canal.
Again, so for me, I feel like you need to value yourself once you've passed, because you are a clinician. You can't let these people take advantage of
Exactly.
you.
And imagine being a clinician and while doing your work, you're thinking about how much money I'm able to get out of it and whether or not
NHS dentistry has been like that, but I feel like there has been a massive shift. So then taking on a dental hygienist job actually opened up another aspect of dentistry where you're
Private
selling
setup, right.
a service and you're getting paid for that. And now, since then, private dentistry is thriving alongside NHS dentistry. It has a completely different domain, but
so-
it helps you upsell yourself and your services,
So if
rather than
you-
being dictated by the NHS about how much you get paid.
Right. So now that is apparently a very beneficial side of joining a private practice, right?
That's it.
So if you were given the choice to choose between getting a percentage of what you do on your patients versus getting versus the other option that you mentioned, which one of these would you have chosen?
Definitely percentage, because you get valued for the work that you put in. You have more time to actually give the patient a good service, like we do in Pakistan.
Sahi.
Whereas over there, अगर आपको दिन के 20 units करने
hours
हैं,
वाला था, सही.
you will just make sure that patients coming in and out, and you're just delivering the units that you need to do per day. So it takes the focus off dentistry itself. So when I got asked to do a dental hygienist, I got trained to manage patients and sort of make patients satisfied enough to pay the amount that you're asking for, because that's a new thing in UK. If you ask somebody to pay for something, they'll be like, we have the healthcare system, why do I need to pay?
Sahi.
So it's been a massive struggle to kind of deviate from that expectation.
Achha, in terms of patient communication, generally patient attitude, how did you find the difference between patient who used to come for their NHS treatment versus the private patients?
So again, my struggle has been that I didn't jump into NHS dentistry straight away. I took my time because I was getting more as a hygienist than you would as a dentist for the NHS. So that actually helped me value myself a bit more.
Was that just your case, or do generally hygienists get paid more?
They do get paid initially. When you're just doing basic NHS dentistry, you actually get allocated more for your time and effort that you put in. So that helped me open up a completely different aspect that most of my friends or people around me were not choosing at that time. So I had to start low at a completely different market to be able to make it to the higher end of that market, because cosmetic and aesthetic dentistry is not covered by the NHS. It's something that if you want to fix the appearance of your teeth, you have to pay out of pocket. Whereas if you're in pain, NHS will help you, towards the treatment by subsidizing your cost. So it's completely different systems which were non-existent when I first started practicing. It was just NHS dentistry in the day. But now you have a different aspect where you can upsell your services that you are offering on the NHS at a higher price. Because you can sell it to the patient. I mean, selling it, but actually making it seem like the patient wants to pay for your service.
So, like, how would you say in terms of managing their expectations was different when you were dealing with an NHS patient versus a private one?
It's the hardest thing ever, because when the patient that's paying would actually value the details that you put in, whereas NHS, they'll be like, I want 3 crowns on my teeth, or I've got
here's my card,
I want to fix all of my teeth. And COVID has massively caused a lot of neglect in dentistry in the UK, because
like dental hygiene?
No, normally as well. Because the NHS is a service that's subsidized. So, people that go to a doctor in the UK,
absolutely,
they don't have to pay anything. It's free. So when they come to an NHS dentist, they pay a lot less for the work that they do.
Right.
So that makes the patients expect more than what they want to pay for.
Absolutely.
So it's hard managing. It feels like I went back on myself to be able to sell privately high-end treatments to patients, and then have patients expect that for 3 units I will fix 3 of their teeth.
सही. अच्छा, वैसे this is such a new perspective to have, क्योंकि अब हमारा तो एक अंडरस्टैंडिंग ये है कि जब आपके पास प्राइवेट प्रैक्टिस में पेशेंट आएगा तो उसकी एक्सपेक्टेशंस आपसे बहुत ज़्यादा होंगी, बट आई एम श्योर कि वो उस तरह से यूके में भी सेम ही होगा, बिकॉज दे आर पेइंग सो दे वांट यू टू डू द राइट जॉब.
Yeah.
पर राइट जॉब वाली एक्सपेक्टेशन तो हर पेशेंट की सेम होनी चाहिए ना, वो कम पैसे दें या ज़्यादा पैसे दें.
Exactly.
But it's also the overutilization of this ability to get your procedure
it's the
done.
over expectation, right? Because like I said, in COVID, there was a lot of people that didn't have dentists for years.
Sahi.
So what NHS did was that it struck off people that had not visited dentists off their lists.
Sahi.
And you couldn't go back to them. So you could only pay privately or not have a dentist. So in that way, a lot of people were without a dentist for a long time because they wanted the cheaper option and they wanted the option that, you know, doesn't cost them much. And in that way, they kind of neglected their oral health for a long time.
Okay. Right. So coming back
that puts expectation on the dentist to fix all of their problems, because most patients that I'm seeing in NHS now haven't had a dentist for 6-7 years.
Oh.
Yes.
Okay.
And it's a lot of work. So now also dentists are getting burnt out because, you know, the funding reduced during COVID and the patients had more problems when they came back. So
वैसे एक तरह से ये बेनिफिशियल था कि वो जो इम्पैक्ट था वो पेशेंट्स पे नहीं आया, लेकिन फिर प्रैक्टिशनर्स पे तो आया ना, विच इज़ वाई एक्चुअली दिस इज़ द फर्स्ट टाइम आई एम अंडरस्टैंडिंग द बैकग्राउंड बिहाइंड द न्यूज़ के जो है ना डेंटल प्रोफेशनल्स की एक जो है वो फुकदान हो गया है यूके में, बट दिस इज़ वेयर इट स्टेम्स फ्रॉम एंड दैट मेक्स सेंस. अच्छा, सो कमिंग बैक टू योर जर्नी अगेन, तो फिर यू स्टार्टेड वर्किंग एज अ डेंटल हाइजीनिस्ट.
I started working as a dental hygienist, offering higher serviced like, you know, treatments like whitening and perio and gum related stuff, preventive stuff. Then you know, reactive stuff that you do in dentistry. There's a problem and you just fix it. And in that way I got good at sort of satisfying the patient for the service that I'm offering, because I had more time. I could entertain them. I could give them a service. Like it's like you know, when you go to a 5-star restaurant for a cup of tea and you go to a dhaba, right? The service, this was non-existent back in the day, but now there's been a shift. So there's been a massive uptake of private stuff where you're giving a service, you manage patients in a different way. So I feel like the communication is the biggest game changer when it comes to dentistry privately, as a together with NHS, but it helps you deliver a service because they're paying for something and you want to be able to.
So when did you decide कि अच्छा ठीक है, now I need to move one scale up, अब मैंने अब like proper dentistry की तरफ जाना है, part 2 दोबारा देना है.
So hygienist was a way to kind of again take a small step into the dental.
Achha, I'm sorry to cut you. You became a hygienist after you had cleared your part 2, right? This was when the offer letters were very bad.
The offers were bad. I didn't want to settle for anything that I felt was unjustified, and how other dentists were not being treated that were not from the UK, that were from the UK. So I was like, I will rather take on a lower job role.
ठीक है.
Than being paid less for my time.
So in your head, was this a temporary position you were at?
It was a temporary position. And also because COVID, there wasn't much openings at that time. Like people were actually working remotely, doing consultations online. And I was like, I want to do something. And I don't want to now, after such a long gap of
have another gap.
Yeah. So I took this on. She was a family friend and I started doing dentistry, and that helped me ease into dentistry rather than that shock when you are, you know, a dentist and you walk into a practice not knowing how to manage things. So I've shadowed a dentist as a dental nurse. I know the procedures, the processes. Then I've eased myself as a clinician. You're still a clinician, you're offering treatments, you're engaging with patients, you're writing notes. So you've got a slow transition, like a cushioned transition into dentistry. So I helped sort of with less pressure, because as a hygienist, you don't have much pressures of getting the outcome right. You know that you're going to just clean and whiten their teeth.
Achha, was becoming a hygienist also the same as becoming a nurse, like a straightforward procedure, or did you have to?
After you pass, you can practice, but I feel like now this process has been exhausted too much that they've closed
I think so, they
the
have.
route now.
Yeah.
But when I did it, I had already passed the ORE. But then afterwards, they kind of created a pathway where overseas dentists could work as a hygienist without passing the exam. But I feel this was a massive sort of step up into the right direction, because it eases you into dentistry without the negative pressures that you face. Like, having a failed root canal in your first month of working as a dentist and not being able to manage the patient with what's happened, whereas you're doing like low expectation jobs and making sure my patient's happy, and then you know how to build a rapport with the patient and you learn to manage patient expectations.
फिर आप yeah, I think you've explained it really well. जो आपने शुरू में बात करी थी ना कि learn patient management without the pressure of being a regular.
And that helps you thrive, because then your personality shows, right? Because you don't have a high expectation and you're able to comfortably deliver things when you're in your element and you know your stuff. Like, come on, perio is something
exactly that, it's not as hard.
We don't even concentrate on perio in
third year के बच्चे कर रहे होते हैं,
but हम उसको कुछ समझते नहीं. आपकी rotation लगती है perio में, you're like, perio, like, why would I go
can we not, आप कर लें.
So I feel like abroad that's a very good transition, because you're doing procedures as a clinician, trying to manage, again, in UK dentistry, managing your notes, your protocols, your expectations, patient satisfaction is where jahan maar khate hai, people struggle with. So when you're doing it in a comfortable environment, then you are able.
You're comfortable with the procedure you're doing. At least
you
procedural
know that it
anxiety
can't go any
hai.
wrong.
Exactly.
Then what you've done, like sometimes I've had a problem where I was polishing somebody's teeth as a hygienist, and I just literally touched his tooth, and he created a massive complaint, thinking that I've caused trauma. Again, patients are looking for those lawsuits as well. So again, it helps you manage कि क्या safe way में कैसे dentistry को practice करना है.
अच्छा, let's talk about the ethical and legal regulations of UK as well. How did you make yourself familiar with this, with their standards of legality and everything?
I think the exam itself prepares you for it. They actually set out कि क्या चीजें हैं. Then attending courses, we have to attend mandatory training for legal and ethical courses on a yearly basis. We have to have it renewed every year.
So like, how important would you say is it for somebody who's practicing dentistry on a regular basis in the UK to understand?
It's the most important thing, because you have this sword hanging, like I told you, over your head, thinking if they make a complaint and it escalates to the GDC, you can get put on probation or have your license taken away or revoked. So you have to always be practicing defensive dentistry in the UK. Even if something, like I told you, I touched a patient's crown with the handpiece,
which you were supposed to. I mean,
I just knocked his top tooth. But again, knocked is a strong word. It just literally
the head of the handpiece, right?
Yes, it flicked his tooth on the above.
Open your mouth, bro.
And I didn't document what had happened.
Okay.
Right? So he completely flipped the narrative, because he had a tooth that was causing him problems. He wanted a implant or something out of it, or a re-endo out of it. So he completely, again, if I had documented at the right time, this was my learning experience, where I was like, if I had documented what had happened, his narrative could be questioned,
right?
And there was my side of the story documented on my thing, whereas I didn't expect a small thing and how it could be turned into a big massive thing. So you have to document everything, make sure you manage the patient there and then. If you have a patient that's unhappy, make sure that you attend to them in a way that they walk out happy with it.
Right. Okay. Achha, so one question that got missed between our discussion was managing the financial aspect of like part 2 as well.
Yes.
मतलब अब तो हम अपनी discussion में वहाँ तक आ गए where you're now practicing as a hygienist, and then the next step is when you practice as a proper dentist. Yeah. But now the only thing remaining between you and a practice is just finding a good job, right? Yeah. Like you've cleared the exams and everything. But and even though you were in the UK while you were appearing for your part 1 and part 2, but still you were not working, you did not have like a proper job. So how did the financial aspect come into?
So the financial aspect actually adds more pressure
Sahi.
on passing, because you'll be like, this is all my jama punji and I don't want to waste any more money on this, so I better get it right.
Yeah.
That adds more pressure, because you'll be like, it's do or die.
Sahi.
And I feel like this is what happened in my first attempt, where I was like, there's no other way, it's so expensive. I've done mocks, I've spent enough already on resources, materials, and everything, and I'm exhausted and I don't want to be able to do this again. But I feel, take that edge off initially by getting a side hustle. Don't put everything in one basket. Try and get yourself a regular job where you can not only make something out of it, but integrate in the society. I feel like if you already know how to manage customers in a customer service role, or even working in McDonald's or a grocery store where you're dealing with not patients, but like people on a daily basis, it helps with you with the language, it helps you with your communication, helps you integrate into society. Because the
society
biggest
integration
stigma is that you don't sound like them, or you don't
look like them,
you're not behaving like them. So
you
learn their etiquettes,
Yeah.
learn how British people expect you to be. They actually do value you as an overseas clinician.
If anything, they're just more polite and they expect you to be that too. Yeah.
So integrate yourself and find a source of income so that it doesn't put too much pressure on you.
Dr. Shiza, मेरा आपसे एक सवाल है. So I'm like, there's no right or wrong answer to this, but generally जो fresh graduates होते हैं ना, वो ये सोच रहे होते हैं कि चलें हम part 1 part 2 करने के लिए अगर किसी जो है familiar source से loan ले भी लें, तो हम ये information gather करना चाहते हैं कि how soon will we be able to return this? मतलब will we be able to start earning in the UK as soon कि हम ये amount सिर्फ test वाला return कर दें?
How would you? The return is quite quick, I feel, because I feel like dentistry is a kind of profession that you get back whatever you invested in quite soon enough. But again, it also depends on the level of dentistry that you're doing, whether you're doing solely NHS or you're doing a bit of private. Right now, the trend is that you do a set amount of NHS as your base income, because you know that amount's always going to be there. With NHS, right, you have these units allocated कि आपने साल में इतने units करने हैं by your principal dentist. So you know you're going to get paid for those units as long as you're achieving those targets. And then your private income is like an added bonus, right? Okay, you can go on holiday with that base income, or you can spoil yourself, or you can invest in a more expensive course that will help you build skills in private dentistry. So I think that now is a good time where there's a shortage of dentists. If you can sort of do NHS, good clinical NHS dentistry, and be able to convert those NHS dentists into private procedures, so again, it's a big topic that I could talk about. NHS and private, they're completely different flip sides of the coin.
Achha, so you mentioned the point about incorporating it into the society, right? I think I want to ask for example, somebody like you who has been in the UK for quite a while now and has been through multiple levels of patient care experience, like worked as a dental hygienist, worked as a associate dentist, and as a nurse as well. Do you think even you still have a hard time sometimes feeling the same as the other dentist who's
100%. Like there's always a first time for a lot of things, right? Because you will either have a tricky procedure that you feel like, is this my skill set, or am I competent enough to actually make this work? Then there will be a challenging personality. That procedure itna bada nahi hai, but that person, you can tell from their body language, they're going to complain about everything. Like they walk through your door and you can tell, like me and my dental nurse will look at each other and be like, yes, this is going to be a tough ride. Even though they've just come in for a checkup.
Let me quickly review my legal rights.
Yeah, so we can tell when somebody walks through your door what kind of challenge it will bring. Again, it's your people skills that you develop through different aspects of integrating into society.
So Dr. Shiza, I think we had a wonderful discussion, but I think it would be unfair if we don't touch on a very important topic, even though शुरू में हम इस बारे में बात कर रहे थे. So I want to understand how you were preparing for a licensing exam. You were like a you were not a fresh graduate per se, but in terms of skill set वगैरह you were fresh. In terms of your confidence you were fresh and new.
Yeah.
How much faith you had in your skill set, right? But while managing your abilities as a graduate who can clear one of the hardest licensing exams in the world, also managing your responsive roles and responsibilities at home, I want to understand if for you it was more of like making your family understand why this is important for you, or were they already very understanding and lenient towards?
For me, I feel like there was always this expectation that I was going to pursue dentistry because I come from such a strong dental background. Alhamdulillah, my dad has made a name for himself here. And I feel like it was a dream for me to actually carry his legacy to a completely different part of the world, and being called by, his name, Dr. Anwar in the UK. So I think my husband already knew, okay, dentistry is in my blood. I'm passionate about it, alhamdulillah.
That's great.
And I feel like if you don't come from a strong, background that's understanding of this, make it known that you've invested 5-6 years of your life to pursue a career and an education that's not cheap in Pakistan as well, right?
Absolutely
you've invested
not.
mentally and financially into a career, and just to give it up just because family doesn't approve. I don't think women nowadays, or anyone for that matter, should settle ke unse permission nahi milegi ya kuch. Make yourself sort of confident in the fact that this is part of your
absolutely for whoever it is important, they should have this conversation early on. अच्छा, in terms of employment, मुझे बताएं कि आपने कभी ये experience किया कि your employer is like would prefer somebody who doesn't have a very hectic personal life going on, who's not a mother?
All the time.
Oh God.
Yes. So even in my current role, where they value and respect me as a clinician, I have heard statements like, but you're not flexible because you have kids at home, or you have to go
flexible आप रात में थोड़ी बुलाएंगे.
Exactly. So my hours are, but the thing is, you need to know your boundaries. You need to know your limits and be confident. If I know I can deliver a service that's adding to their practice, I know I can set the terms for the things that I want as well. Like, abhi main Pakistan aayi hu, I've taken, normally they give you 2 weeks of leave in a row, and I've asked for more because alhamdulillah, I feel like I can deliver my targets in an efficient way, so I can get to set terms as well. In Ramadan, most people were working 9 to 5, 9 to 6. I could ask them, because I feel like if you don't ask and you don't value yourself first, other people don't value you. So do set your terms as well. Know what you're adding to the equation, and be confident in asking for things that you feel. So even though they have said things to me, not just the current position that I'm in, but people have actually said, "Oh, we're looking for a male figure who can work longer hours, who doesn't have family commitments."
I want to understand.
I feel like you should value yourself and be able to, because I think HR and human rights is also quite strong. So if people say that to you directly, you can't contest that.
No, but Dr. Shiza, I want to understand ki what is it that they expect out of somebody who doesn't have a very hectic personal life versus somebody who does? Matlab, why do you think they're having this conversation? Do they want to keep you extra hours or what? It
is. So like, the normal working hours are like 9 to 6. I work 10 to 5. I have already told them that, I have to drop my kids to school. So I will only be able to come at 10. But again, I've built that place. You can't just go in with that
as the first new person.
I said, I've worked my way up. As a hygienist, when I was working, I knew that I cannot dictate terms. But when you've built a place for yourself, when you've built, a niche where you are bringing a lot to the table, then they do kind of value you for that as well. So it's like putting in the effort first. I have worked long hours, and I've had, alhamdulillah, a very supportive spouse who manages things with me, together with me, so that I'm able to excel in my career. But I feel like there's no black and white answer for this, because it's a joint effort that you have to make as a as a wife, as a mom, and then you have to put in the hard work initially to be able to reap the rewards for that later.
Right,
You can't go in
absolutely.
with the mindset that you want it your way or no way.
But
They have to see what you bring. Again, a business or a practice will value you when you're generating revenue for them, you're meeting their targets, you're not giving them any chances to complain that you're a liability. So once you've touched on that, then you have the capacity.
I think then that is true for everyone. Like even in any capacity, not just in healthcare, जितना ज़्यादा आपका experience होता है या जितना ज़्यादा आपने अपनी worth prove कर दी होती है उस organization को, फिर उतना वो आपको edge भी देते हैं, आपको 9 बजे आने की ज़रूरत नहीं है, and so forth.
Exactly. So you have to build that, and having that expectation from the beginning is
absolutely
really unrealistic.
Okay, so Dr. Shiza, I think we touched base on everything and you answered everything wonderfully. Thank you so much for being extremely honest with all your answers and offering a perspective that is going to be very relatable to everybody. I hope and I'm sure that anyone who has had confusions such as in terms of what mindset should they have and how will they navigate the waters of UK once they like step into the decision of clearing ORE, etc. I'm sure that they will get a lot of help. But before we go, we have a rapid round for you. This is my favorite round because it's a no-brainer, as you were mentioning earlier. It gives no time for no time to think. But sure, feel free to actually, you know what? No, I won't let you change your answers. Okay, so number 1, who do you think should not pursue ORE pathway at all?
Somebody who's not mentally resilient.
Resilience, okay.
Yes. Because if you're resilient, you can bounce back. If you feel like you don't have the mental capacity to bounce back from a difficult situation or persevere, then this journey is not for you.
Right. What do you think are some mistakes that delay the process of ORE for many candidates unnecessarily?
Procrastination,
all right.
Again, having too many options that, okay, I can go to the UK or the US or Australia. Narrowing down your options and kind of avoiding the confusion, unnecessary confusion. Try and eliminate, too many options so that you can focus on what you want to do.
ठीक है, सही है, that's a fair answer. All right, next. What was the first culture shock you experienced in the UK?
That you're not a dentist when you go to the UK.
Okay,
you're a normal
that's interesting.
person because all your life you've been, again, यहाँ पे VIP culture इतना होता है that we think we're professionals, we're dentists, we actually, deserve so much. But when you go to a new place, you relocate, you're actually starting from scratch. And I feel like your profession doesn't define you when you're there.
Right, okay. So for part 1, self-study versus coaching academies, which one would you prefer?
Both.
For part 1?
I feel like it's a lot easier now because they have academies that actually tell you कि आप हमारे notes पढ़ लें, आप pass कर लेंगे. And they didn't have that back in the
100% guarantee.
Yes, but it's true. They've actually worked hard to make those things more concise. Whereas back, 10, 12 years ago when I started thinking about it, we had to navigate that ourselves. So if you're getting something a lot easier, do take advantage, but also kind of refine yourself as well.
Okay, so my final question. Do you think UK is still worth pursuing for dentists in 2026?
100%. The market is more open now than it was back when I was, and me and my friends were struggling. It's because, Brexit has kind of created a deficit in dentistry in the UK. Most people, UK practiced experienced clinicians are moving abroad now because they're finding greener pastures. And now there is a definite need for dentistry. Plus now there's also a different avenue of private dentistry which wasn't present before. So you had to work for peanuts, long hours and meet their quotas. Whereas now you have a different side of dentistry which is more relatable to Pakistani dentistry where you get what you offer. Basically.
Absolutely. Thank you so much for those answers, Dr.
You're
Shiza. You
welcome.
performed very well in the rapid round. I was hoping कि जो है वो मुझे शायद cut करने पड़ जाएंगे कुछ questions, but again, thank you so
Thank
much.
you so much for having me. I feel like this is not the platform for a person like me because there's so many esteemed, mashallah, dentists in Pakistan.
Oh, no, I
And
disagree
even
completely.
I feel like even my batchmates, batch 14, I have to give a shout out to all my friends. I feel like this was probably the best and most accomplished batch of Fatma Jinnah. Again, I
sure.
don't want to step on people's toes, but alhamdulillah, I can say proudly that most of my friends have made it big, alhamdulillah, in different parts of the world.
And so have you.
And it's such a proud moment to actually, think, wow, my colleagues and my friends are doing so well in every part.
It must be such a refreshing feeling to stay in touch with the same people with whom once you were worrying about anatomy ka prof,
I know.
and now there are other things to worry about.
I mean, you can't take them out of the equation.
Absolutely.
Your friends and your journey where you've become dentists together, they always stay with you. Alhamdulillah.
Again, thank you so much for your time, Dr. Shiza. It was wonderful talking to you, and I hope, inshallah, that the next discussion we have is when you are practicing in multiple clinics all across the UK and perhaps have your own dental practice over there.
Inshallah, yes, that's a dream, maybe to open up an overseas Anwar Center of Dentistry in the UK.
Absolutely, taking the legacy above and beyond.
Inshallah.
Okay, so this was our time with Dr. Shiza Anwar. She is a wonderful dentist who currently practices in the UK and is always available and more than happy to share her insights and guide anybody who is currently going through the process and has reasonable questions. Thank you for watching. Until then, Allah Hafiz.